Thank you very much, Chairman Blunt. Secretary Azar, welcome. Thank you for being here. Mr. Secretary, let me just say at the top that I'm alarmed by the recent developments that we've seen in the Office of Refugee Resettlement and how it's handled children in its care following President Trump's inhumane family separation policy. I've raised questions with you about that before. I hope we can continue that conversation today as well as we review this administration's budget proposal. And I hope today we can get a straightforward answer on many of the other healthcare issues that I'm hearing about from my constituents in Washington State. Because when it comes to helping families across the country who are struggling today to afford health care, this administration has continually said one thing and done the opposite. And at the end of the day, none of the president's empty promises say as much about his health care priorities, frankly, as his decision to champion a partisan lawsuit that could be catastrophic for families. Because if Republicans get their way in court, they will strike down protections for pre-existing conditions, strip away health care families that got their health care through exchanges and Medicaid expansion, and give power back to the insurance companies to offer low-quality coverage and leave patients, of course, with higher health care costs. And much like that partisan lawsuit, President Trump's partisan budget exposes the truth behind that spin. Despite his promise to the contrary, this budget would slash $500 billion from Medicare and nearly $1 trillion from Medicaid, threatening millions of families' access to high-quality, affordable care. In fact, on seemingly every page, this budget proposes taking huge steps backward on our nation's most urgent challenges, including the ones that the administration says they care about. It proposes a small step forward with additional investments to fight HIV transmissions, but it takes an enormous leap backwards with the cuts to Medicaid, which, by the way, covers more than 2/5 of the patients with HIV care, not to mention slashing investments in combating HIV overseas. These Medicaid cuts would take us in the wrong direction when it comes to addressing mental and behavioral health challenges like the ongoing drug overdose crisis or the increasing suicide rate by making it harder for people to get the care they need. In some states that have expanded Medicaid, the program covers 4 out of 5 people receiving treatment for opioid addiction. To make matters worse for behavioral health, the budget eliminates funding for the new suicide prevention initiative at the Centers for Disease Control and Prevention, which Congress included last year in our bipartisan spending bill. And then there is the maternal mortality rate, which is worse here in the United States than in any developed country in the world. Each year, 700 women in our country die from pregnancy-related issues. Those deaths are mostly preventable, and the impacted women are disproportionately Black and Native American. Instead of treating this like the emergency that it is, this budget actually offers a sleight of hand. It proposes expanding the maternal mortality initiative Congress created in 2018 by $75 million, and I appreciate that. But unfortunately, that pales in comparison to the proposal to cut over 100 times that amount from Medicaid, which actually pays for nearly half the births in this country. And if that weren't bad enough news for women and families, this budget continues the Trump-Pence administration's harmful trend of putting ideology over evidence and patient health by excluding Planned Parenthood from federal funding and eliminating the Teen Pregnancy Prevention Program. At a time when our nation is facing a health professional shortage, this budget proposes cutting nearly $800 million from programs that support tuition assistance, loan forgiveness, and training for several 100,000 health professionals annually. And at a time when too many families are already forced to choose between paying for health care or other basic needs, this budget seems to go out of its way to make things worse for people living on the brink of poverty. It eliminates safety net programs and critical assistance to millions of people, like the Low-Income Home Energy Assistance Program, which, as we know, helps families afford heating and cooling, and the Community Services Block Grant, which gives states resources to address the challenge of poverty. It eliminates the Social Service Block Grant and greatly reduces programs which help families facing adversity from keeping their heads above water. And as it continues, the strong bipartisan investments in child care and Head Start Congress secured in our last spending bill, this budget eliminates funding for preschool development grants, which provide high-quality preschool to tens of thousands of families. Finally, Mr. Secretary, as you know, I've been in close contact with health experts dealing with the 2019 novel coronavirus outbreak, which you declared a public health emergency last month. As we work to bring hundreds of Americans from China's Hubei province and affected cruise ships safely back home and quarantine them for 2 weeks at a cost of roughly $6 million per flight, I've been pressing for more information on what resources are needed. I sent a letter to you in the Office of Management and Budget Director Mick Mulvaney earlier this month expressing my deep concerns about this. Now, you finally sent an emergency supplemental request last night, like I've been urging, and I'm very concerned this request is not enough to ensure that we are putting all the necessary resources towards this emerging threat, including making sure our states and local public health departments have what they need to respond to this crisis and being reimbursed for those costs. And I'm very concerned about how thin the details on that are, because despite what this budget proposes, not a single public health expert has told me the thing we really need to do right now is cut the CDC's program by 9%, or cut critical global health programs by $80 million, or cut the Infectious Disease Rapid Response Reserve Fund by $35 million, or cut public health preparedness and response programs by $120 million. This is not going to help us deal with this. So while I recognize the efforts happening across your department to contain this virus, I have to say this is unacceptable. It's important that we stay ahead of this crisis, and we are ready when additional cases are detected in the U.S., meaning we cannot plan on the cheap or at the last minute. I've always said a budget is a reflection of our values, and that applies here. While President Trump may not always tell the truth about his values, this budget speaks volumes to all of us. It leaves no doubt that the President is not serious about fighting for women's or for families' health care or addressing national crises like drug addiction, maternal mortality, or suicide. He's serious about cutting Medicaid and Medicare and cutting critical public health programs and safety net programs and health care workforce programs and more. Families across the country should know that we as Democrats have no intention of letting those cuts happen. We're going to continue to fight for patients and against these attacks.